Hi, welcome to the show. Today I'm here with Rebecca Rabinowitz, co-owner of Cpred, and we're going to be talking about some of the life-saving skills that we need to know, and we're going to be spending some time doing some demonstration as well. So, hi Rebecca.
Hey Judy.
How are you?
Great, thanks for having me on the show. I'm so excited.
Oh good,
I get to share how anyone can save someone's life.
That's a big thing.
Yeah, it's very simple too, so you don't be afraid, that's the whole point.
So tell me first, before we even do our demonstrations, how did you get involved in this?
Oh, you know how life is, here, there, and then eventually you get to where you are now. Let's see, I scuba dive. I'm not sure if you knew that, I'm a scuba diver.
Can't say that I knew that.
And so is my husband, and he became an instructor for Patty. And as part of that, he also had to instruct CPR. So he became an instructor for CPR and first aid.
Okay.
Simultaneously, his sister Meg, who's an amazing EMT and volunteer for the community for many, many years, is a CPR instructor through American Heart. She works with the Bureau of Emergency Services, Putnam County. So she was an instructor, and she was doing work all over the place, working really hard, and she was just needed some help. And so Tom cross-trained, became an instructor also for the American Heart Association, was able to assist. Eventually, she moved on to a wonderful company called Lairdal, and she's working for them with high-end demos. And so we took over. So Tom is an instructor, and I became an instructor. Now we teach for Red Cross and American Heart, and ASHI, and a National Safety Council. So we really have grown.
Wow. Okay, so tell me about the training. If I want to get trained, how long does it last? What does it include? All of that.
Okay, great. Well, if you want to be certified, then there's a certain amount of time you put into the course, and there's a course structure. It's a combination of video and hands-on, a lot of hands-on and practice, real-time scenarios.
Okay.
But for the really simple stuff, and we even go into schools now, you can do something called hands-only, or it's also called standby, or let's see, compressions only CPR. Anyone can do that.
Okay.
And you can save a life. So CPR, cardio, pulmonary, resuscitation, CPR is what you do when someone has no sign of life and you can really bring them back.
Is there ever a time when you shouldn't do CPR?
No. Oh,
okay.
Well, make sure they need it first. If someone's taking a nap, you don't want to wake them up with compressions. It's kind of nasty.
No, that's not what I meant. But there's no risk. There's no risk if someone is not breathing to do CPR.
It can't get any worse than it is. You can only make it better.
Okay, good. And so you said first aid too. That's included in this?
Well, it's a choice. Some people need CPR and first aid for themselves or for profession, and some people only need the CPR, and some people only need the first aid. So we have different courses to help the person or whatever they need. We do a lot of CPR for healthcare professionals who need it as part of their being recertified every 2 years, just to stay on top of it. It's not something you ever want to do. No. But you want to be able to jump in there and do it right away without hesitation.
I'm sorry to interrupt you. Is it something that once you're trained you won't forget? Like, do you know what I mean? Like, if you don't ever use it, hopefully, would you forget how to do it or not do it right?
Actually, you do need to practice, and that's why people are recertified as part of what they do for a profession, or just because they need to get reacquainted with it. So a lot of professions ask their folks to recertify every 2 years.
Okay.
And lifeguards have to recertify every year.
Oh.
And you want your lifeguards to be
do.
good at CPR.
You do.
Because you forget for like a year, you're not, and boom.
Right,
it's
again like riding a bike,
so
you want to practice a little bit.
And also, we invite people to come practice with us anytime. Even if they are been certified a year ago and don't need it, they can come back anytime and just practice with our mannequins.
Oh, okay.
So we really encourage it.
Yeah, I would think that you could, I don't know, lose your touch. I don't know if that's possible.
Well, you want to feel confident.
Yeah.
That's what it's about.
Yeah.
It's an emergency. When people have an emergency, it's like comes at you out of a surprise, and you just want to be able to act.
Right. And not be afraid to do that.
Again, you shouldn't be afraid.
Okay, so you brought some toys here.
Yeah, they're toys. Some people like just holding them in my class, but it's actually a tool for saving lives, and this is our pretend person. It's a really good idea not to practice CPR on real people.
Got it.
That's what these mannequins all are about. So we have mannequins in our classes.
So babies are different though, right?
Well, they're little.
Okay.
So yes, the actual technique is different because their bodies are smaller.
Okay.
So an adult, you do CPR one way, and an infant another way.
Okay, now what about, babies are notorious for shoving things in their mouths and choking.
Oh yeah. In fact, choking is the #1 reason small children become unresponsive. It is choking, because severe choking can lead to cardiac arrest. So part of our course is teaching choking relief for infants, children, and adults.
Wow, okay.
So it's part, even though it's not CPR, it's part of every CPR class is choking relief, because it's actually more common.
Right, I'm thinking you see people in a restaurant, can't breathe, you know, that's, yeah.
Yeah, they won't be able to tell you they can't breathe, by the way. They just will be, and that's how you know. They can't say it.
I was going to say, how do you know they're really choking? They can't talk.
Hopefully, if they remember from earlier education, the international sign of I am choking, and it is so embarrassing to be choking suddenly in a public place, and people don't want to be doing that, but you really need help right away, and the best people are the ones who are with you.
So walking out of the room is a bad idea.
Not good.
Got
yes, you want to stand up and get the attention that you really need at that moment.
Okay.
So yes, stand up, and the international sign of I am choking, and hopefully the people around you recognize it and take action.
Yeah, okay, so let's talk about the little ones first, because they choke all the time on stuff.
All right, so right now, right here, I'm going to teach you something that can save lives. Okay, this is specifically for an infant, and this is choking relief for anyone 12 months or under. In the world of CPR, 12 months and under is referred to as an infant. So this is the technique for
so
infants.
that's still a little kid. I'm thinking, okay, a year old. You're looking like a year old.
Year and younger. That's what we call an infant. In CPR, a child is anyone under puberty down to age 1.
Okay.
So we're talking about a baby who has severe choking, and you know, because they turn blue, the face, the lips specifically turn blue. It's called cyanosis. And of course, they're making little noise or no noise at all, and being the wise detective that you are, if you see that there's a half-eaten something or other right next to them, we can assume that the other part is stuck in their airway, making it impossible for them to breathe. Action, take action. The first thing you want to do for an infant who you suspect has a severe choking is to hold them like this. Okay, I call this the V hold. It's the letter V made by the thumb and the forefinger, and you're going to hold the jaw securely. Notice my arm is between the two legs. I'm going to have a secure hold on this infant. He's not going anywhere.
Okay.
Except upside down.
Okay.
Upside down. You want the infant upside down, and I have got such a secure hold that I am supporting his neck. So I'm going to protect him from injury, believe it or not, as I hit him. Okay. 5 back slaps between the shoulder blades with about as much pressure as you would use to empty a bottle of ketchup. You've got hardly any ketchup left. Bottom of ketchup bottle. Thump. You're using gravity. His head is below his abdomen by at least 45 degrees, and whatever was in there just came out. Whether it was liquid, solid, whether it was a marble or a grape, or anything. Because what you're doing is you're actually hitting his lungs from his back. But he's so well supported that you're not injuring him. Also, the other hand, this is called the heel of the hand, is on his chest. So you're actually pushing the air from his lungs down and out. Now, if that doesn't work, and it should, it works 99.9% of the time. If it does fail, and you know because he's not breathing yet, you want him to cry. You don't hear crying. You want to see him breathe, and you want to hear him crying. He's not. Therefore, I'm going on to stage 2. By the way, if it doesn't work after 5 back slaps, I'm calling 911.
Okay.
You want help fast. If it's not going to work,
okay, so you
really
try
wanna
this
call
first
911.
before 911.
Absolutely, because it's done. 2 seconds. He seems to be happy. I might have him looked at by a doctor if I think there might have been some damage, for sure.
Okay.
Especially if it was an object that might have been sharp and might have injured his throat. I would definitely take him to a doctor. But if he's not suffering anymore, he's a happy baby, and the problem is solved, I don't have to call 911. But believe me, I am calling 911 if it doesn't come out that quickly, because if it gets worse, I certainly want professional help there.
Okay.
So after 5 of those, if it doesn't work, and I'm calling 911, or if anyone is with me, they're calling 911.
Right.
I'm going to grab the back of this baby's skull, secure hold once again, and flip him over. So now he's belly up, but now on the other hand. Okay. Now, of course, you can do this standing or sitting.
Okay.
Free hand. I'm just going to use 2 fingers. These are actually called chest thrusts. Okay. In the middle of his chest, or her chest, 5 of these thrusts. And it's actually the same action as a compression.
Okay.
But the baby is upside down. This baby is quite alive, and I'm trying to get that food out, or that dead moth, whatever it is.
Okay.
Dead bug. I don't know. You've got boys. What did they eat when they were 3 years old, 2 years old?
I think someone swallowed a dime once, I think.
Yeah,
you know?
yeah, that coin.
Yeah.
So 5 of those, and if it still doesn't come out, then you go back to your back slaps. So it's a series of the 5 back slaps, followed by the 5 chest compressions back and forth until you get results. And most times you get really good results.
Okay, and again, I'm thinking, okay, I can manage a baby.
Right.
Okay, and what if this baby is, 11 months old? Isn't that harder because they're bigger?
Yes, you'll have to make some adjustments. So
Yeah,
you know
but,
your
but the
baby,
same principles
the
apply.
same concept. You want the baby's head below the abdomen by at least 45 degrees because you're using gravity. So you're using gravity to help it down and out, and you have a good support system so that you're supporting this baby. You're not dropping him on the floor. That would not be
That
good.
would be bad.
Add a concussion into the mix, right? We don't want that. We want results ASAP,
Okay.
and that really is the best thing you can do to, prevent choking completely.
I
and
hope
then
that
move on.
everybody who's watching this who has children just
Yep.
paid attention, because that was amazing information.
Thank you, and it's really simple. But once again, take good care of your baby, and prevention is the best medicine. Just watch that child when he is eating.
Right, and we were
at
just
all
talking
times.
before we came on camera about cutting those grapes in half.
Oh yes, anything that can fit down a baby's airway, you want at least half the size. And of course, you're watching them. If you watch them, then of course it's not going to happen. So, if you do have multitasking like most people do, things happen.
Right.
But just knowing these really simple skills can really save a life.
That's terrific.
So this is just the beginning of the class.
Just the beginning. Okay, you brought another thing
I
here.
brought a thing. I brought yet another toy or tool, depending on how you look at it.
Okay.
This is a rescue mask. Okay, most, all lifeguards would have one of these as part of their tools. EMTs have them. This actually is a barrier, so that if you are breathing for someone, it protects you from germs. It's got a one-way valve. It's called a pocket mask. It's also called a resuscitation mask. It's also called CPR mask. And it can collapse and be put in a container so that it can be easily put in your glove compartment. So you use it as a barrier to breathe with if you're breathing for somebody.
Oh, okay.
So that's a nice tool.
Okay.
So if you don't want to do mouth to mouth, and you have this, but that brings up yet something really, really, really cool.
Okay.
It's called compressions only CPR. So what you just learned so far is choking relief for a live child,
Okay.
and that's to prevent cardiac arrest. But if it doesn't work and that child stops breathing, that will cause the heart to stop, and that is called cardiac arrest.
Okay.
And that's when you want to do CPR.
And that's what we're going to show
Yeah.
when we do our dummies in a minute.
Yeah, do our dummies.
Do our-
Practice on our mannequins.
Practice. That sounds so much better.
It's all good. I think we know what we're talking about.
We do. We do. Okay, so we're going to readjust our situation
sounds
here,
good.
and we're going to come back and learn how to do some simple CPR.
You got it. Hands only.
Hands only. Terrific. Thank
Yep.
you. So we've reorganized our set, and we're going to watch some and learn some through some demonstration.
Yes, definitely. Okay, thank you, Joe, for being here and being our student. Okay, so what we're going to do now is demonstrate compressions only CPR, bystander CPR. The best thing you can do for anyone who has no sign of life, no breathing, no pulse, is to become their heart, which is basically compressing their heart down for them 100 to 120 times a minute. And there's a wonderful song out there that people can keep in their mind for the beat of the song. So what do you think that beat is?
Oh, I know this. This
Okay,
is
what
Staying
is it?
Alive.
You got it.
Yeah.
Great. So staying alive at 100 compressions per minute or a little faster is a good song to have in the head.
Okay, just a quick question.
yes.
What happens if you don't go fast enough?
If you don't go fast enough, then the blood that you're squishing through the body doesn't get to the brain fast enough and the other organs, and you're not oxygenating them as much as they need to be.
And if I go too fast?
Then a similar thing. It's just you're not letting that heart come back to neutral so that it can refill.
Okay.
It's all about oxygen. Believe it or not, the oxygen is in our blood, and that's what we're circulating through this body to keep them alive.
Okay.
When
great.
someone becomes unresponsive, no breathing, no pulse, like our friend here, want to give him a name? Let's give him a name. What do you think?
I'm partial to Bob.
Okay, Bob, here we go. Unfortunately, Bob's collapsed with sudden cardiac arrest, so his heart's not pumping blood. Within just 4 minutes of his heart stopping and not moving, not stopping completely, but not moving blood through his body, and that's what a heart does, it circulates. Within 4 minutes of this not working, his brain is going to start to not receive the oxygen that's in the blood.
Okay.
Okay, so what we want to do is take over the work of the heart to help circulate that oxygenated blood through his body to prevent any brain damage.
Okay.
And if you start right away and keep going, you are basically the first person to save him. So let's say no one helps poor Bob. Bob's chances of survival are pretty much 0. Okay, what if someone calls 911? Then Bob's chances of survival are up 3%.
Oh, because you're still waiting. He's still
Yeah.
not breathing while you're waiting.
But
Got it.
if you start CPR right away, within minutes, hopefully a minute, then his save rate is up 35%.
Oh, wow, okay.
So CPR is that good. And then if you throw an AED in there, the automated external defibrillator, and use it, then his chances of survival are up 50%.
And AEDs are everywhere now. You see them everywhere.
And it's best to be trained to use an AED, obviously, but it's there for everyone. Okay, so here we go. So Bob has no sign of life, no breathing, no pulse. His chest isn't moving. If you don't know how to take a pulse, it's not the time to learn how to take a pulse. Of course, you take a pulse if you're good at it. But there are other things to look at. Is his chest rising and falling?
No.
You know, if he did, I'd be running out of here screaming poltergeist. Okay. Because we know Joe's not real. But if he was a real person, his chest isn't rising, his color drains from his face, blue lips. Okay. Go ahead with a head tilt, chin lift, and if you don't suspect spinal injury, it can help him breathe. I don't see any sign of life. His chest isn't moving. Okay, I'm going to start CPR. I'm going to start, and I'm going to have you take over. All right, this machine here, it's wonderful. It's made by Laerdal, and it actually helps us see our rate of speed and how deep we are. We want to go to 100 to 120 compressions per minute, and we want to make sure that we are in that green area on that meter, so we know we're going fast enough, and this means we're going deep enough. Want to try it? Come on over. So what you want to do, Joe, I call this is the name I came up with, starfish hand. So one hand could be left to your right. That's it. And then you put the heel of your hand on the center of his chest. This is, I'm lifting your hand just a little bit. Sternum. Okay, that's the bone down the middle of your chest. Put the heel of your hand, which is that, here, middle finger line with the nipple line. Great. Other hand grabs those fingers and pulls them back. So you're actually lifting your fingers up. So just pull your fingers up. The only thing touching that chest is the heel of your hand on the center. So even though the heart's off to the side a bit, you're crushing the entire bony structure of the heart down, of your hand onto the heart. Okay? Get really tall. Like your arms are the legs of a table, vertical. Okay, now start pushing. Okay, look at that gauge. Probably go faster and deeper.
Joe, he's not living. Now he is.
Yes.
Okay.
Keep going. Want to oxygenate that brain. Keep him from brain damage. Okay, just keep going. All right.
And how long do we do this for?
Bump, bump, bump. Staying on. There you go. You better not stop. Here's heart. Don't stop.
So you don't stop till somebody comes and helps you.
No, I'll tell an EMT pushes your hands out of the way and takes over, or he suddenly says, "Leave me alone."
Okay.
Well, obvious sign of recovery. You can stop, and then you put him recovery put. How's he doing? Well,
Oh,
how
look,
are you
he's
doing?
doing really
A
well.
little deeper. Got to hit the bottom. Nice. Bump, bump. Now, if you're exhausted, and this is exhausting, by the way, and right here, and I guess the time for EMS to get to your home in Putnam County, believe it or not, EMS to arrive, 15 minutes.
So you can do this for 15 minutes.
You could do it for a lot longer if you had to. But you
Wow.
do run out of oxygen, so compressions only CPR is good for about 4 minutes. Eventually you're going to have to breathe for him too.
Okay.
But for the average adult, there's pre-existing amount of oxygenated blood. Are you tired yet, Joe? Okay, 2 minutes is a good time to trade out.
Okay.
Every 2 minutes. Okay, I'm going to take over for a little while. And when someone does take over, make sure there's no interruption of those compressions.
Oh, so you would have had to slip in. You would have had to slip in right where he pulled out.
Absolutely. And because most people have one side and the other, if you can access both sides, and some would be on the other side assisting. Now notice that our friend Bob is on a floor, right? If Bob had been on the bed or a sofa, we have just dragged him to the floor. You cannot do CPR on something soft. You need the resistance for these deep compressions. And anyone can do this.
So tell me, how hard are you pushing?
I'm pushing pretty hard. How hard am I? Good question.
Because you said, for the babies, like you're
I know.
you're smacking out ketchup. So
So that was for choking relief.
okay.
That's not CPR.
Now,
That
how
was
hard are we
choking relief.
pushing
Now we're
here?
doing CPR. Okay, we're doing a couple of things. How deep are we pushing? I'm showing you the height of my thumb, by the way. 2 to 2.4 inches deep.
In.
Yes, deep.
Okay.
Okay, so you're crushing his ribs.
Okay.
Remember, the heart's underneath those ribs. Those ribs are there to protect the heart and the lungs, and we're doing something rather violent. We're crushing through the ribs.
Okay, so, people say, I don't want to do it, I'm going to break someone's ribs. I'm afraid I'll break their ribs.
You will break their ribs if you're doing a good job, if it's an older person whose bones are more brittle. You got to get to that heart.
Okay.
The ribs can heal, brain cells can't.
Got it.
Once the brain cell's gone, it's gone forever. That's permanent brain damage. So
Okay.
you're pushing on the heart to save the brain and every other organ in the body as well. You are his basic life support, and you have to keep going.
Okay.
But yes, indeed, he'll need some breathing too. So want to learn about breathing?
Yes.
Okay. Eventually, he'll need more oxygen because we're using it up. In fact, if we're doing CPR for anyone under puberty, he's going to need both compressions and breathing.
So babies will need that as well.
Yes. Now, if I'm going to segue over to doing CPR for infant. Okay, Joe is going to help demonstrate how to do CPR on an infant. Of course, their bodies are smaller than adults, so the technique is different. In terms of timing and compressions to breath, it's the same as the adult. So when you're doing compressions and breathing for an adult or a child or an infant, it's all the same, 30 compressions and 2 breaths. We were showing you before compressions only CPR, but that would only be for an adult. An adult is anyone puberty or older, and only for about 4 or 5 minutes. So do you mind kneeling next to baby over here? We're going to check to make sure baby needs CPR. He might be napping. You only do CPR on someone who needs it. Okay, but if you decide to do it, decide quickly and then keep going. Okay, is the chest rising and falling on baby? Do you see it? Do you see it going up and down? Has the color drained? Are the lips blue? Cyanosis? No movement of baby? Nothing? Okay. Judy, can you please call 911 and get the AED?
Yes.
Thank you. Okay, help's on the way. Okay, there's no sign of life here. Let's start. One finger between the nipple line. In our babies, it's basically there are 2 raised dots that represent that. And so you're just 2 fingers, because these babies are tiny, and I want you to put your fingers like so. So instead of the full hand as you did for the adult, it's just 2 fingers. And we're going to push 1/3 the depth of his chest, which is about 1.5 inches, at the same rate of speed as what you did before. 100 to 120 compressions per minute is how fast you do it. And we're going to do a set of 30 of these. Okay, so I'm going to pretend to be counting because I already messed up my count. 25, 26, 27, 28, 29, 30. He needs oxygen. Small kids know it need oxygen. To do that for an infant. Okay, these are all been sanitized. Your mouth is going to cover his nose and mouth. Watch me first. When you breathe for a baby or a child, just a tiny little bit of air. Too much makes problems. And then back to the compressions. So I'm going to help you. Head back, opens the airway. Only do that if you don't suspect spinal injury. Your mouth is covering both his nose and his mouth, and you're going to watch his little chest rise and fall. Perfect, just 2. Well done. And then you go right back to your compressions. So just keep an eye on that chest, because that will tell you if the air goes in and that you're not over-breathing.
So how hard did you blow?
Just a tiny bit. It's a visual gauge, so I'm watching the chest rise, and that will tell me how hard to blow.
Like you blow out a candle?
That's not a bad analogy.
Okay.
But the idea, it's visual. So I'm trying to show that if you're looking at the chest rise, that will tell you how much.
Okay. And on a child, would you actually see your air going in?
Absolutely.
You would.
Just like that. Do you want to try that again to see if the air goes in? Head back, very, very gentle, and watch the chest rise. Perfect. And then back to your compressions. And once again, you keep going until there's obvious sign of life or someone pushes your hands out and takes over. Okay?
Is the breathing just, we have a couple more minutes before we wrap. Is the breathing similar in adults? I just want to kind of.
Is the breathing, absolutely, in terms of watching the chest rise. But if you're doing breathing for an adult, pinch the nostrils, head back, and you're only breathing
because
in the
obviously you cannot cover their nose and their mouth with your
for
mouth.
Only infants, because they're tiny.
Yeah.
Adults and children, you're pinching the nostrils shut, head is back, and only breathing through the mouth and just a little bit of air.
Okay. You have given us invaluable information today.
Oh.
I hope that everyone follows these. First of all, I hope that no one has to ever do this.
Absolutely.
But if they do, it's nice to know that we have some guidance here.
Right. Call 911, number 1. Scene safety, call 911 and start helping.
Terrific. Thank you so much for coming
Thank you,
today.
Judy.
And I hope that maybe we saved a life somewhere.
I'm sure we did. I hope so.
Perfect.
Thank you.